Have you ever been scolded by your mommy to not to eat too much sugar or sweets because you might have diabetes? People get diagnosed with type 2 diabetes because they eat too much sugar in their diet. But what is diabetes in the first place? To understand diabetes, let us take a look in our blood. Our body uses a type of sugar called glucose, which is a type of sugar that you get from eating carbohydrate-rich foods. So glucose is important in our blood because it needs to travel to our cells to provide energy for us. But in order for the glucose to enter the body, it needs a hormone made by the pancreas called insulin. So the pancreas is an organ in our digestive system that helps break down food and control the levels of the blood glucose and produces insulin. So for people who are diagnosed with diabetes, it is difficult for the glucose to enter the cells and therefore causes a build-up of glucose in the blood. So this is called the high blood sugar or hypoglycemia. And a person experiencing hyperglycemia can be tired, hungry, thirsty, and frequently urinating. So when you try to add tablespoons of sugar in the coffee and if it's sweeter than it is supposed to be, you taste sugar and less coffee. And that is what high blood sugar is. So we offer a wide variety of lessons for primary students online and help prepare students for the incoming PSLE. So if you are interested, you can send us a message on all our platform and click on the link in our bio to book your free 30-minute call with us. Type 1 diabetes is an autoimmune disease. So the immune system plays a big cause to type 1 diabetes since it mistakes cells in the pancreas as intruders in the body and therefore attacks it. So the result is that the pancreas cannot produce any more insulin and glucose cannot enter the cells. So which is why patients who are diagnosed with type 1 diabetes have to take in insulin physically after every meal. So in type 2 diabetes, the pancreas still produces insulin, but the cell will resist letting the glucose in. This will result in the pancreas producing more and more insulin for the body. In this specific type, people who do not have a healthy diet or physically fit are at risk of developing it. So the most frustrating part about having diabetes is that you have to constantly watch your blood sugar rise or fall, and in both situations. So you have to prepare for it. With the insulin that the patient intakes can lower the blood glucose level too much, and it is called hyperglycemia. A diabetic patient can experience different feelings such as weakness, anger, confusion, dizzy, etc. So which is why when the blood sugar is too low, the patient has to intake foods that are high in sugar, like when you make lemonade and all you taste is sour lemons and no sweetness in it. So in diabetes, it's either blood is lacking something or there's too much of something. So it is difficult for a person to have diabetes, and therefore we should know how many people get affected by it. But for us, we should know how to avoid eating too much or too less to keep track of our blood sugar. And if you have a friend who has diabetes or does not know about diabetes, like this video and share it with your friends.